Good afternoon, everybody. My name is Joshua Lewa, and I'm the Associate Director for Admissions and Recruitment at the Brown School at Washington University in St. Louis. So welcome to our kickoff for this year's virtual information sessions. This is a series of sessions that are going to go on every month throughout the year, where we're going to cover a wide variety of topics, and this one is no different than that. We're going to talk about our overall high-level introduction of our MSW, MPH, and MSP programs. So there are a couple of things as far as housekeeping is concerned. One is some of you submitted questions prior to this session, and we're going to get to those questions near the end of our presentation. The other piece is that some of you who are watching live may want to submit some questions, so please send them in. We'll get access to those, and we'll make sure to answer any of them that we didn't cover throughout this presentation, just to make sure that we can cover as many that are relevant and make sense as possible. Take a look online after this session. We have other events, and you can also watch some of our archived videos as well. So again, we're talking at a high level about the Brown School and our degree programs, but what I'm most excited about, we have a lot of PowerPoints that we're gonna go through and get you a lot of information, but I'm most excited about the panelists that we have here today. And so you're looking at a couple of our panelists. We'll get you introduced to the rest here in a moment. They're amazing students who will get to share their experiences here in their respective programs. And so in order to kick that off, why don't we have you start by giving us your name, your program, your year, your either concentration or specialization, and then also your hometown. We'd love to know where you're from as well. So do you mind starting?
Yeah, of course. So my name is Christian Vargas. I'm currently a second-year MPH student in the generalist specialization, and we'll cover what specializations and all that are in a moment. And I consider my hometown Pasadena, California, but I have been living in Shreveport, Louisiana for about half my life now, so I guess that kind of makes its way in there as well.
I'm Zach Goldman. I'm a MSW student in my second year, and my concentration is mental health, and I'm originally from West Hartford, Connecticut.
And good to be with you all. My name is Kellen Roybal. I am a second-year MSW MBA student here studying health and healthcare administration, and my hometown is Denver, Colorado.
Hi everyone, I am Taylor Caldwell. I'm a second-year MSW student studying violence and injury prevention, and I'm originally from Nicholasville, Kentucky.
Great. So thank you all for being here. We really appreciate all that you have to bring to us. As we mentioned, we're going to talk about this high-level interview, and we're going to toggle back and forth between the PowerPoint as well as our group here to make sure that they provide a bit of information. We do have one other person who's going to join us here in a little bit, and with movie magic, some of our people might disappear a little early as well, so get ready for that and stay tuned. All right, so we'll go ahead and right into the PowerPoint. All right, so the Brown School, you'll read this here. This came up from our new leadership, and this is something that's really part of our impact statement of being dedicated to equity and committed to impact. It's a phrase that you hear a lot here with our faculty and staff, and what we really want to say is that we're translating the research that we do to actionable solutions and bringing solutions to communities where the support and help is most needed. We actually have 3 degree options here. We have public health, social work, and social policy, and as you can see this rundown here, the programs that we recruit for here with my office is the Master of Social Work, the Master of Public Health, the Master of Social Policy. We have dual degree options as well. You can see the MSW, MPH, and then of course we match that with the MSP, and then MPH and MSP can go together as well. For students who are currently here on campus, you also have that 3-2 option, so please come and check us out to learn more about that. All right, so who's the Brown School? Like, what is this? How does this all work? I thought you all were Washington University in St. Louis. That's a long name. Well, this is really how it works out. Washington University in St. Louis actually has 7 schools that make up the university. You can see medicine, law school, engineering, art and architecture, arts and science, and business. And of course, we have the Brown School, which covers social work and public health. As far as who we are when it comes to our numbers of our students, this is a breakdown of our incoming 2018 class. So 2019 numbers will be in pretty soon, but for 2018, if those numbers, I mean, depending on what programs you're looking at, those numbers could look pretty small, or they can look pretty big. For us, actually, it's a pretty large class that came in for fall 2018, and I think our panelists represent most of that. So 344 new students started. You see the average age, of course, the median age is 24, but a range of 20 to 57. 22% of our students were international, representing 23 countries. 42% of our students are students of color. We have 60% who are first generation undergraduate and or graduate students, And here's the one part that I think is pretty interesting, which is that 79% of our students come from outside of the St. Louis region. All right. The other question that we're going to, in a moment here, we're going to hear from our panelists, but for those of you who are kind of just exploring and figuring out the field and trying to figure out kind of where this all fits into your interests, what is social work, what is public health and social policy? So again, the most broad definition that we can provide for you here is social work is a field that's aimed at improving the overall well-being of populations, especially those who are historically underserved at a micro, meso, and macro level. So that's a little bit different from people's traditional social work kind of perspective of either you're a counselor or you're taking people's kids from court because of difficult, challenging issues, or you're a caseworker. There's a whole lot of things you can do with a social work degree. Public health, of course, is the science of promoting and protecting health of people and communities where they live, work, and play. This, if you want to look at the idea of maybe medicine being treatment, public health being the idea of looking at prevention and looking at, again, looking at it from a community-based perspective. And then social policy focuses on promoting social and health equity for humans locally, nationally, and internationally. So I'm going to jump to this panelist because we actually have people here on our panel that I really want to kind of get your perspectives. Actually, why don't we start with the two of you? Well, actually, I don't want to say that because I don't want to pin any of you in a corner. But if you could just tell me your perspectives on kind of your perspective on what public health means to you and what social work means to you.
For sure. So for me, public health, it's a very transdisciplinary field, so a lot of people kind of have a little bit of a difficulty coming to terms with what all is included under the umbrella of public health. But for me, at least, it's looking a lot more so at those social determinants of health. So medicine and generally the profession of Western biomedicine in general focuses very much so on the individual and on those biological, genetic, individual level microenvironmental factors that impact somebody's health. Public health is more of like a holistic approach that looks from the cells to society level. So, there is some of that emphasis is placed on kind of that cellular level, those biological processes that lead to disease progression. But you also look from a top-down level. Okay, what does the institutional landscape look like? What does the broader sort of community and neighborhood landscape look like? And what are those other social factors, neighborhood composition, education level, employment opportunities, exposure to different environmental pollutants, environmental racism, those sorts of things. So it's a lot more of those contributing factors that somebody lives in, works in, and grows up in that overall end up also impacting the way that disease manifests itself in the body.
It's great. Thank you so much. And I want to open this to Zach or to the rest of the panel as far as kind of your just take on social work.
Yeah, no, definitely. I get that question a lot because social work is a super broad field. It encompasses a lot. I would say that social work is anything that advances the message of social justice, and that can be through micro, meso, or macro level work. Micro level work is more kind of what you might traditionally think of in social work, so maybe counseling or case management and that type of thing, whereas macro level work is maybe making those policies that influence what the micro level social workers are doing. And then meso is kind of anything in between there. And then social workers usually try to do a little bit of each. So you can't make a change by just working at the macro or just working at the meso or the micro. So you have to be well versed in all the different fields. And I would also say the big difference between social work and maybe counseling or psychology is that the social work really focuses on the person and environment model, which is that all the different environments that a person is in really affects that person's behavior and thoughts. And it's not just looking at that person's maybe thoughts in isolation, if that makes sense.
Great. Thank you. Do any of you want to take a shot at it?
I think Zach nailed social work perfectly. I think one thing I would add on is emphasizing that interdisciplinary and transdisciplinary piece that Christian also mentioned in the social work program. And so, as Zach briefly touched on, you might find a social worker who works in the micro level and the macro and the meso. But what we are particularly interested in here at the Brown School is how we move between the two. And so when we're working with a client one-on-one, how are we also advocating for them on the policy level? And when we're at the policy level, how are we trying to think about the ways in which we're working with governments and other institutional enterprises and systems? how are they focusing on the one singular person who might need a service or handout in that way. So I think he hit on all of those things, and I just wanted to reemphasize that's what we do here at the Brown School.
It's great. Thank you. And so you actually teed us up for the next slide here, which is a slide from Veda, who's just a wonderful faculty member here. What Veda says here, of course, is if we as a society have disparities in income and education, we will have disparities in health. People can't begin behind and just miraculously catch up, barring something extraordinary. Through teaching and research, I want to make the extraordinary possible. And so, one of the things that we are really fortunate to have is to have social work, public health, and social policy under one roof. I'm just kind of curious as you all think about, I know that you take most of your courses within your respective areas and within with your peers from those programs, but I'm kind of curious if any of you see an impact of having so many programs underneath one roof, and I'd love to hear from any of you.
So the thing that comes to mind immediately right now is actually one of the classes that I'm taking currently. It's called Protection of Women and Children in Humanitarian Responses. And that's taught by Dr. Lindsay Stark, who comes to us from Columbia University, has a background in global health. And so that's where you get, like, under one roof, a class of social workers and public health professionals who are both interested in working with refugee populations and some of the unique challenges in terms of healthcare, both physical and mental. And so that brings like a pretty unique perspective insofar as you really do get that transdisciplinary collaboration in the classroom with some of the conversations that you have with your colleagues outside of class too. They bring up points that you didn't think of before, just because of the way that, education has been traditionally siloed into separate disciplines. It's like, okay, but one of the things that Dr. Stark is pushing in the class is that when you operationalize that in the real world, what you come to find is that siloing, those kind of silo-based approaches don't work at all. And that's something that, even humongous organizations like the UN High Commission on Refugees are finding out that the traditional approaches that they've had, the cluster approaches is what they are called, are just completely ineffective for dealing with complex humanitarian emergencies.
Wow, great, thank you. Anyone else have any thoughts on that at all?
I would say that the keeping that social work person and environment model in mind, the public health and the social policy can help social workers learn more about that environment that the person is in and all of those different barriers that they face. I would also probably say that it's important for sort of, as you were saying, people to be able to talk with other people from different disciplines and be able to share the information that maybe they've learned in their class that isn't as widely understood as other people that are maybe studying social work would understand in a way that isn't kind of condescending or coming off as you're wrong. And yeah.
That's great. I always think about when I first joined the Brown School community and we talked about transdisciplinary approaches that these are areas or fields where they're not so arrogant that they think they have all the answers to really solve these complex issues. And it does take a wide variety of disciplines, intelligences, experiences to address such complex issues. And I love that idea. I also loved the idea of kind of I think, Zach, you mentioned the micro, meso, macro approach to work. I know in my experience when I worked in the nonprofit sector for a short while, I was working on all three levels, whether it's direct service and care with young people and their families, or whether it was working on policies around tax credits, or even meso-level policies around keeping your house open to allow kids to live there. I mean, there's a whole lot of things that go into really serving the community. But ultimately, all three areas, social policy, public health, and social work, are about being a contribution and making a difference in your own way, whether it's research, policy, or practice. So I appreciate that. We're going to jump right into the curriculum in this next slide. And so our curriculum is designed to be different. Of course, we talked about the extensive breadth of macro and micro, the hard sciences, the social determinants of health. You can find your path and you can make an impact here. We, of course, look at, it's a values-based, kind of, all of these have a value of equity and inclusion. We have an anti-oppression framework for sure. And of course, we've heard the concept already of transdisciplinary. And then of course, we say traditional and emerging. Maybe emerging as a nice way of saying non-traditional careers, but I guess now the questioning is, what is a traditional career in social work and public health? I think that we're blowing those doors wide open, and I think we're kind of moving away from this idea of having there be traditional jobs. All right, so let's talk about kind of the breakdown, and in a moment here we'll get our panelists to talk about their experience in these programs. But our master's program, generally speaking, is 2 years, 60 credit hours. As you can see, there are 10 concentrations. You want to look at this as kind of like your major. So this is kind of what the area that you're going to study in. You'll also notice the last word on this slide says individualized. What that means is you can essentially create your own concentration. We have some really clear guidelines from CSWE, who oversees our competencies and making sure that you are hitting all the marks in order for this to be an effective social work degree. With that being said, students who individualize might pair up a couple of areas of interest, or they might create something brand new that's not on this list. And maybe they're interested in working with veterans and mental health, and so that might be an interesting thing that they would work with advisors to make sure they hit all the core competencies for that. These are actually optional. These are our specializations under the social work program. And so, again, for some of you, you have an opportunity of doing a policy specialization, or you can do a deep dive in doing the dual degree and getting a Master of Social Policy as well. But there's quite a few options for you as well here. And then our Master of Public Health program, again, 2 years, 52 credit hours. And so these are our 6 specializations within the MPH program. And so we'll get our folks here a chance to talk about these as well. But again, consider these like your major in public health. And then when we talk about our dual degrees, these are the options that we have in-house. So just to be clear about the language, dual degrees are any 2 programs that are essentially operated outside of the Brown School. So any mixture of those becomes our dual degrees. And we're going to stop right there and return to our panel just so that we can make sure that I want to really get their perspective on things. And so, all right, so just let's talk about the classroom. I mean, I think this is something that's really important for folks to kind of figure out. Kind of what has your experiences been like? Like, what does this curriculum actually look like on the ground in the classroom? Just general impressions. And I'd love to hear from everybody on the panel on this one. Mm-hmm.
So I think that in the classroom particularly, it's really great because there's really small class sizes. But also with the curriculum, you do micro, meso, and macro work, which is really significant and really important with the work that we're doing. Because I particularly want to work with youth, and so I'm going to be more doing micro work. But I'm learning a lot meso and macro that are bigger picture things that are definitely going to help me learn how to navigate the environments that my clients are in so that I can serve as a better advocate. My favorite classes so far have been by Professor Lorian Carter. She teaches a lot of like the general practice 1 classes where you learn those micro skills, and you do a lot of like in the classroom hands-on practice. Like you seriously practice every class period doing something, whether it's individualized group work or family work, and that really got me started on learning how to be confident in my skills. So yeah.
I think one of my favorite lessons that I've learned in the classroom is the distinction between passion-based work and logic-based work. And as a successful practitioner in both social work and as a joint degree student for business, how the 2 really intersect for the work that I do. I'm looking at being a medical social worker short-term and a hospital administrator long-term. And to be an effective worker in both of those regards, I'm going to need to understand social justice and the social determinants of health, and be able to approach those from a point of passion, but when communicating the need to address these disparities with businesses, with politicians, with NGOs, and any amount of stakeholders throughout the entirety of this social issue, if you will, I'm going to need to approach that from a place of logic as well. So I kind of learned in the classroom, particularly in the foundational level course, social, economic, and political environments, how to operate from a lens of like how I see you seeing me, seeing you seeing me. So you can just go through that iteration multiple times, but it really gets at the core of understanding where passion can lead you astray in the same way that serving yourself and your community logically can lead you astray. And that's, I think, the most important thing I've learned in my classes, and I can't recommend that you explore that more throughout the variety of foundational classes that you will have.
I would say also coming in to the Brown School, your first year is really setting the framework for the rest of your work, at least in social work. That's what my degree is in. But so that first year, you kind of get a little mix of everything. And coming into the Brown School, I thought I want to do mental health. I'm very micro-focused. I don't have any interest in policy, research, none of it. But my first year, my favorite class was social justice and human diversity, which I was not looking forward to, honestly. I was just like, okay, I'll take this class. And it ended up being my favorite class that I've taken here probably. And it's really helps inform the work that I'm doing now. So I'm really thankful that the Brown School places such an emphasis on that really well-rounded education. And then your second year, you can really kind of more dive deeply into whatever specialization you're interested in.
Yeah, I'll just add real quick to what Zach is saying, especially about the well-rounded education. And I feel like the curriculum is very much so designed to bridge theory and application. So you're going to be getting, especially in the first year, a lot of those foundational classes. And this is true of the public health program as well. You're going to be getting a lot of those foundational classes to kind of set the framework for what you're going to be doing later on in your second year and stuff. And so, you know, there's a lot of that theoretical base that you need in order to then be able to have the practical applications. So for example, in epidemiology, you're learning a lot of different epidemiological methods in order to both have your descriptive epidemiology of the question, but also the kind of the meat of the problem is like that analytical epidemiology part of the analysis, which tells you like really trying to get at what are the root causes here, what's actually driving the health outcome that I'm interested in. There's also a large focus on skill labs as well here at the Brown School too. So we want to make sure that, you know, because this is a professional degree program, so we want to make sure that you're leaving this with several different marketable skills, whether it's like grant writing, whether it's different management classes, whether it's specific statistical programs, R, Stata, SPSS. You know, the Brown School's curriculum is designed to be flexible depending on what you particularly see your career pursuits as being. And so we try to have a lot of very specifically tailored options so that everybody can get a little piece of the pie.
Great. Thank you very much. All right. So we're going to move on to talk about some of our joint degree options for you as well. So in the public health program, we actually have some partnerships with anthropology. If you're in the PhD program there, if you're admitted to that program, you can do a joint degree. Of course, you can do an MBA or JD. Of course, the med school degree, you would apply to the med school here first, get accepted there, and then you would apply to our MPH program, as well as occupational therapy would be another option, the MSOT and MPH. From a social work perspective, we have a wide variety of joint degrees as well. Again, these are across WashU programs that are outside of the Brown School, and that's how we refer to it as a joint degree. So for MSW, you have the MBA program, you have the Masters of Arts in Education, or MAED. Of course, we have the JD program, and the Masters of Arts in Architecture, Urban Design, and then we have a partnership with Eden Seminary for the Pastoral Studies or the Masters of Divinity as well. So when it comes to advising here on campus, you get a lot of attention. And that's a good thing. I think what you'll notice about our program, and one thing that really stands out from an admissions standpoint is we're really kind of a high-touch admissions office. We really like to respond to people and stay connected, and we hope that that mirrors your experience while you're here as a student. You get actually 3 advisors. So you have an academic advisor, as you can see, who help you with making sure you stay on track to graduation, making sure you're getting registered for courses, et cetera. And they're well versed on kind of faculty and other support networks here at the university and at the Brown School. Your faculty advisor, of course, is your connection into the classroom experience, but these are people who are going to be your mentors long term. And these are people who are doing research within the field, and so hopefully they're your guides. And then your field education advisor is a person who's going to help you find your practicum, because of our programs having practicum experiences. While you will choose your site, these are people who are going to be your guides in identifying those sites. And they're going to be your conversational partners as you're kind of experiencing those in the field experiences. Our field education does have daily drop-in hours, and so you're able to kind of work with them on an individual basis as well. And then, of course, we've talked about our faculty a little bit so far, and we're going to give some folks here an opportunity to talk about their experiences, but we're really happy about having an 11-to-1 student-to-faculty ratio. You know, my experience with graduate school is your faculty, they are the people who are going to help be guides. I know my faculty from grad school are people who I've called for personal and professional reasons for decades, and so These are people who do a lot of formal and informal. And they're the people who are leading the field. They're the ones who are writing the books. They're the ones who are doing all the research and presenting it. And that's the reason why we have such strong programs here at the Brown School. So, just based on that, I'd love to kind of hear from you all to talk about your experiences. But before we get started, we actually do have a panelist who joined us, kind of in a unique situation. As far as being a panelist, she's an alum, but I'll let her introduce herself some more. So we'll turn it over to you, Najwa.
Okay, so my name is Najwa Walden. I graduated with my MSW from the Brown School in 2018. My concentration was violence and injury prevention, and I specialize in research, and I'm also back at the Brown School this year as a first-year doctoral student in the Public Health Sciences program.
Great. While you have the camera, or at least while we were talking about you, I'm going to put you on the spot. You're in the hot seat.
All right.
So if I feel very fortunate and lucky to work with some talented faculty, and so would you mind talking about your experiences with faculty here?
Oh yeah, I had amazing mentorships and experiences with faculty. And coming from my undergraduate institution, I understood the value and the importance of mentorship early on. And so a lot of the faculty that end up being mentors to me at the Brown School, I was able to communicate with even before I even started the first day in my MSW program. And one of my first mentors was Dr. Sharita Butler Barnes, because she was doing a lot of work at the time on violence and injury prevention against Black girls, which was my area of interest, and started out like the first semester of my first year being able to be a research assistant under her project, and was able to get some very invaluable experience as a qualitative coder, and that definitely informs my area of research and my area of interest now. And extending on to the type of mentorship that I was able to gain during the program, I was able to work a lot with Professor Jack Kirkland and served as his teaching assistant and eventually his teaching coordinator for 3 years in a row. And then during my last year, once I entered the research specialization, I had some really good conversation and some really good mentorship from Professor Drake, who is the head and the leader of the research specialization, but someone who is really passionate about being able to grow and nurture future scientists.
That's great. You almost caught me drinking water. All right. We're going to go ahead and call it out there. So, I'm really warm right now. Do you also want to talk about your experiences with faculty? I'd love to kind of bounce it right back to my friends over here.
Sure, yeah. So what I would say is the faculty aren't only experts in what they're teaching, but they're also really dedicated to teaching. And additionally, they are actually usually practicing what they're teaching. So they're not just people who have researched whatever the topic is, but they're people who've actually seen the barriers to implementing what they're talking about. And that's been really, really nice to have. I would also say that the faculty is really accessible outside of class, if just to get coffee or lunch or talk about future plans. I've definitely utilized that, and that's been great.
Experiences for you with faculty? I know you do quite a bit of research and some other things.
So I don't do research in like a formal capacity sense, but regardless, the faculty here are still super accessible. Like right now I'm thinking about one time, there's a lot of background context to this, but essentially we were at a protest out on the lawn in Mudfield, and it was like 10 o'clock at night or whatever, and one of the professors decided to join us. He does a lot of different global disability research based in Afghanistan. He's out here with the students, fighting for the same principles that we also believed in. So that was very reassuring. Like a lot of our faculty too come with this social justice oriented lens too, even on the public health side, which is very, very refreshing. It's honestly one of the reasons why I came to the Brown School in the first place, was sort of that focus on health equity and the social determinants of health, social justice, et cetera. But even outside of that, it's been very accessible. Like even so far as just like, having a conversation with a faculty member after class, or shooting them an email about, what you're interested in and whether or not you can help set up a kind of mentorship opportunity. That's actually how I'm actually talking to one of the new faculty hires now, Dr. Salvo, who does research regarding Latinx health disparities. She has a couple of projects based in Austin, Texas that I'm interested in working on. So yeah, it's just very, very accessible. So that 11-to-1 student-faculty ratio like really lets you have that kind of personalized attention and like have access to those opportunities that you might otherwise not know how to access or even ask for.
I know you mentioned Lorianne before, but we'd love to hear from either two of you about your experiences with faculty.
Yeah, absolutely. I think that while we do have 3 advisors here, it's really important to just note that faculty and staff at the Brown School really care about you as a person. So I can't name the amount of people that I have like dubbed as like my additional advisors or my additional friends that are faculty and staff who have really like given me emotional support, have really guided me along the way, even if that's not their particular like assignment or job. So they super, super care about you here. They will go out of their way to make sure that you are successful here. And I think that's super important in mentorship as well.
To touch on that going out of their way, I'm hoping I speak for everyone here, but in my experience, the faculty just know you and not necessarily you as a student. And I can exemplify that through receiving an email one day on Sunday at 2:30 p.m. last semester where a professor sent me an email saying, I read this about health policy in the New York Times and I thought of you. And so that just kind of speaks to the level that your faculty really ingrain themselves in your interests and do their best to support you along that line. So I can't regard them highly enough.
That's great. Thank you all. It's when I first started working here, I would tell students, like, why don't you reach out to faculty if you're interested and you see some research you're interested in, kind of just email them or have us introduce you. And being out in the field and doing some recruitment, having students tell me like, oh yeah, I reached out to Dr. So-and-so or Professor So-and-so, and they responded, and we have a phone conference set up to me. Just was a way of me testing out that this idea that faculty are that accessible, and so I love hearing that that's the case. We're going to switch gears a little bit and move on back to the slides to talk about research and practicum opportunities. So there are a lot of research opportunities. We have 15 research centers within the Brown School, and you can see a listing of them there. There are different ways in which you can get involved in research. There's assistantships, research assistantships. We have partnerships with the Washington University Med School. We just do a lot of research in general. I think our students, again, have had formal opportunities to get connected as well as informal ways of getting connected. And I do say that if you do have a sincere interest and you want to find out more, definitely go online at brownschool.wustl.edu. That's brownschool.wustl.edu, and take a look at all the great things that we're doing and make sure that you get connected to that. We also have these community-based initiatives who are doing research, and the idea behind this is that we have opportunities that are impacting us right here in St. Louis. As you kind of heard from our panelists, none of these folks are from St. Louis, and I am not either. Yet some of us have decided to stay longer than we had planned to. And I think it speaks to this, what a great community St. Louis is. That's why we are Washington University in St. Louis. But we wouldn't be a school that has social work, public health, and social policy if we were neglecting our own hometown. So it's a great mid-sized city where we have great partnerships both across town as well as across the institution. We also have a partnership with the medical school and the Institute for Public Health. And again, there are opportunities to work with faculty in the med school as well as public health program in order to do research. We're going to move forward. So you can see kind of a list of different ways in which students get involved in research here that we've talked about, including presentations, co-authoring papers. For those of you who want to move on, like Najwa, to pursue a PhD, I think having the opportunity to research and to publish is definitely an invaluable experience. When it comes to field education, we interchange field experience and practicum experience. Essentially, it means you're applying what you learn in the classroom to the field. It could be at a research site, or it could be at a place where you're doing direct practice. You could be working for one of over 400 partner sites. What's up there on the PowerPoint is our traditional full program for social work. Of course, those of you who are coming in advanced standing would just do the concentration practicum. And then we have our public health practicum hours and our social policy, which requires a full-time internship. All right, so I guess we'll turn it back to this group here. All right, do any of you have any research experience that you'd like to share with our audience?
I'm trying to think.
Well, I know, let me tee you up a little bit.
Okay.
So I know you worked with Jack Kirkland a lot, and this may not be considered traditional research, but
Mhm.
this immersion experience of being within our community would be something that I think is, just as impactful and effective, and I'd love for you to share a little bit about that.
Absolutely. So I was one of the first students to actually take the immersion before the first year. So I was an anomaly, and thankfully, trailblazing, there have been a lot of first years who have been able to attend the immersion before the actual first year because of that opportunity. And I was able to get in contact with Professor Jack Kirkland because my grandfather actually worked at the same hospital as his niece. And so my grandfather was having a conversation with his niece about how his granddaughter was on her way to Washington University in St. Louis, and his niece was like, well, what program? And he was like, the social work program. And she was like, my uncle's there. And so he ended up giving her my contact information. And so Professor Kirkland called me and said, I want to know about what you're doing, why you're here, why social work. And I told him the things that I was telling people at that time, which have changed, but I was really interested in understanding what interventions would have been successful for me in my life, because I identify as a survivor of sexual assault, and there were a lot of different areas in my life where I needed additional people and needed additional advocacy, and they weren't there. And so he felt like doing and participating in the immersion, which was located in East St. Louis, would give me the opportunity to understand more about the systematic interactions and the institutional vulnerabilities that made me someone who was at risk for experiencing sexual violence in the first place, which was a perspective that I didn't even realize was in existence before attending the Brown School. Was really looking at therapy and just having a one-on-one relationship with my clients. And so after the immersion, I pretty much did a 180 from wanting to be a therapist or wanting to be a counselor with working more with systems and institutions. And so I would consider like the first practicum that I experienced to be a research practicum, because I ended up being able to work with East St. Louis School District 189 to be able to do a needs assessment, to be able to understand how behaviors in the classroom were linked to sexual violence or sexual victimization at home. And so did surveys within a couple of different health education classes to be able to understand like how children verbalized or use specific terminology to be able to talk about their victimization, and then also be able to talk more in depth about what type of intervention students desired or felt like they weren't getting anytime they asked for help, understanding more about how students asked for help, and then was also able to stay on for an additional semester to actually develop that intervention, like what would a sex health education program geared to prevent or be able to encourage advocacy for people who are at risk or considered previous victims, like what would that actually look like? And from there, like the research snowball continued. So after that experience, I was invited to work at Adler University with Dr. Elena Quintana. She's awesome, at the Institute for Public Safety and Social Justice, because she was working on developing a similar intervention before like re-entering citizens. And so for people who had been previously incarcerated, what did it look like for them to re-enter society and also gain like their sexual intimacy again? Like what did it look like for them to be able to pursue a partner? Or what did it look like for them to be able to talk about consent? Or what did it look like for them to be able to talk about the desires that they had? So that was pretty much the beginning of my experience in research and practicum.
Sounds like sounds pretty powerful. I guess I'm kind of cheating a little bit because this group of people who are on this panel are clearly people who I like and I know really well. Actually, I like all of our students. This is the group that I like, but I love you all. But I've known some of these folks from their recruitment process itself, whether it was here on campus or some of them I tried to talk into going somewhere else or at least trying something else, and they proved me wrong. So I've learned a lot from these students as much as hopefully I've served them. So thank you. I appreciate that. Is there any other practicum experience that really stand out that people want to share at all?
I think that since I was not as interested in macro work when I came here, my first practicum experience was really unique in that it allowed me to do micro work while like learning all about macro policies. So I did my first practicum at the St. Louis Circuit Attorney's Office in Victim Services. Got to meet with clients of burglaries, robberies in the city, but also learned in my supervision with my field supervisor there. Every single hour, we do supervision for an hour every week. She was really there to help me process how I was like realizing that policies were affecting these people. And that's important, to be able to sit down with someone and process your thoughts and help them to help you be a better professional in the long run. So yeah, that was really fun.
Yeah, again, I stay inspired. These are experiences I've never had, and I think they're pretty amazing. Again, we have 400 sites, so there's a lot of opportunities for you to kind of get immersed, get involved, and kind of connect your learning to what actually happens in the real world. We're going to switch back over to the PowerPoint to talk about a few other things here. One of them, of course, is our student-centered approach. Up there you'll see we have a whole list of people who are here to support you in and outside of the classroom, from the academic and student affairs division to other areas. So you see Stats Lab, we have the global programs. There's a couple things I want to point out. One of them, of course, is you'll see something called Events at the People's House. Can anybody yell out what the People's House is?
The
Dean's
Dean's
House.
The Dean's House, yes.
Okay.
So the Dean gets this awesome house, that's part of her leadership compensation, and I don't know exactly how it works, so don't let me tell anybody's business. But what we do know is our Dean has set a strong and high example. I think she hosts at least 3 or 4 events a week. I mean, trust me, if I'm the dean, it ain't happening like that. But I respect the fact that she does that, and I've been to her house multiple times, and I know that most of our students have been to her house at least one time. They've hosted book clubs or just socials and different events there. So there's a lot of ways that you can get involved, both in leadership opportunities, additional support. We have our own financial aid person. We have our own career services, which actually we'll move and talk about next. Our career services is where you can get all these different opportunities, trainings, experiences. I can tell you that our career services is dedicated to you the rest of your life. I've ran into alumni who've been wandering the hallways and kind of lost at some of our new construction. And I said, can I help you find something? And they say, oh yeah, I'm an alumni from 2015 or 2012. I'm looking for career services. And that's the great thing, that career services will stay with you, help you secure opportunities, and then 5, 6, 7 years from now, if Zach says I'm still in St. Louis and I'm ready to go back to Connecticut, he can check in with career services and they can help him find opportunities and coach him along the way. So I think that lifelong commitment that we provide to you is just really important. And then as far as where our graduates end up, we're going to show you a real quick list of kind of a whole host of different areas, or nationally, internationally. They're just doing a whole bunch of different areas and different things. Our alumni are working around 50 countries around the world. So I want to go back to our panel and just to talk about just outside of the classroom. If you could talk about what are some of those resources that you may have taken advantage of, whether it's student leadership or any of these other offices that we briefly discussed.
I would just say that the Career Center also hosts a wide range of events throughout the year. I probably haven't taken advantage of them as much as I should have, but a couple of ones that I've been to that have been great have been resume workshops, some LCSW information sessions, and just networking events. And like I said, there have been a ton also that I haven't taken advantage of, but probably should have.
I think the social side of it lends itself to just as much as the service side. So going back to the dean and the dean's house, the dean really makes herself known among the Brown School community. And so not only do you have a space to kind of interact with someone of just really good social work and public health clout in the field, but you also gain some one-on-one insight, if not 1-on-10 insight, where you and your social network are at her house, be that the student associations or anything like that. And so I just really like that is available to us as students as well, just to get our names in front of someone who can help guide us a little bit further.
I definitely took advantage of the professional development opportunities and seeing them really as opportunities to network. Like, I'm a very big person, and I believe that a lot, you can go a lot further based on who you know and not just what you know. And so people from like the US Centers for Disease Control, people from the World Health Organization, people from the med school, like there's somebody on campus in the Brown School from some world-renowned organization here on campus every single week. And so like the opportunity to network with them, to learn from them, to be mentored from them is accessible to all students. And so I feel like I definitely took advantage of those networks and those relationships.
It's great. Yeah, so I appreciate y'all sharing. You know, I do think that so much of your time is spent studying and in the classroom, but we also know that as graduate students, a lot of your time is spent outside of the classroom, and so it's really important to pay attention to that. We're going to move to another slide that I'm sure that you all are curious about, which is funding your education. And so when it comes to funding your education, I know that we always try to figure out like what's the need of Brown School students or even graduate students in general. And so here's a list of ways in which students typically fund their education. So through your application itself, there's a scholarship opportunity that, and so you'll do a few things in order to make that happen. All you have to indicate on both your public health and social work scholarship paperwork is, do I want to be considered for funding or scholarship, merit scholarship? You just say yes. Of course, there's external options, and you can find some of that information online. There's fellowship opportunities across the campus and at the Brown School. We do have work study for graduate students, part-time employment. Of course, students do student loans, and then of course, there are other ways in which students cover their expenses. So based on, as far as our scholarships are concerned, all of our students who request one will complete a videoed interview. You do it on your own timing. It's timed, but it's a platform that we utilize. There's a range of scholarships for different interests and backgrounds and experiences, but 100% of the students who ask for a scholarship will receive some level of merit scholarship. They're based on a whole host of things that you'll see up there. I really do strongly suggest, as you're applying to our programs, if you're thinking about funding and scholarship, that you don't hesitate to contact our team, talk to one of our either professional or our student staffs, and get their experiences and kind of figure out like what are the best ways in which they navigated this part of the application, as well as they're considering how do they consider financing their education. Everybody has a certain different story. They're probably not going to tell you exactly their scholarship number, but what they will share with you is kind of how they navigated it, and maybe what they've heard is our successful approaches to making sure that you address that as well. And then we also have something that we started a few years back, which is our need-based scholarships. There's a limited number of these. There's a specific kind of formula and paperwork, or at least a process that you have to go through. And so that we just want to make sure that you are aware of this is an opportunity for you to kind of take a look more at that. And all right. So at this point, actually, we are ready for questions that were pre-submitted as well as questions that were sent to us live. And so for our remaining panelists, you might imagine, I've noticed through the movie magic of cameras that we made some people disappear. They had to go to class, which is the right thing for them. And so, so we're gonna go ahead and I'm gonna jump into some of the questions that we got ahead of time, if we haven't answered them yet, and then we'll jump into the questions that were submitted live. I think we have plenty of time to do that. All right. So this is a student who is out of state, and they're asking about kind of living expenses, like how do you deal with living expenses? Because there's no difference between, we're a private institution, there's no difference in cost for out of state or in state, so that's a non-issue. But how do you manage kind of living expenses transitioning to a place like St. Louis? And I'd love to hear from any of you or all of you about that.
I'll kick us off. I'm coming from Denver, Colorado, which has a significantly higher cost of living than St. Louis does. So that was a nice surprise for me. I can tell you that I pay less for all of my expenses monthly than I did for half of rent in Colorado. So I'm enjoying that quite a lot, and I did end up financing my 2 degrees here with student loans, and I'm able to work on the side a little bit with Josh in the Office of Admissions, and that helps supplement that living a little bit more, but I found it very affordable for me, which was one of the big draws to me to St. Louis.
I have a little bit of a different experience. I came from more of a rural town in Kentucky, and so the living expenses here were definitely more. However, I find that they're really, really manageable, and St. Louis has so much to offer as far as like free entertainment. So like our zoo is free, the museums are free. There are so many things that you can do here for even if they're not free, that are low cost, that really, really make living here worth it. And I have friends who live in different cities, and comparably, like living in a city with the other cities, this is definitely more affordable than other major cities. So it's reasonable, even if you're coming from a rural area.
Yeah, and just kind of to piggyback off of all of that, I totally agree. St. Louis is super affordable. There's tons of free events happening all the time. I have a little bit of a unique situation because I'm a 3-2 student, which means that my senior year, which was last year, was also my first year in the Brown School, so I save a year. So really, I'm only funding one extra year, which helps me a lot. And then, as Josh said, just applying for scholarships, that helps a ton too.
All right, so just briefly about our global opportunities in social work. If you're in international social and economic development concentration, there are opportunities to do work. And please contact our office. We'll get you connected with some of our advisors in that area. We have opportunities in Kenya, Haiti, Tanzania, Ecuador, India, Uganda, all over the world. And so there's some really good opportunities there. We have a question from an international student who submitted it, and really they want to know about kind of experiences of international students. Just to let you know that we're actually on early November, we're going to have another virtual information session about the international student experience. And so you're going to actually get a chance to hear from quite a range of students from different parts of the world who will talk a lot about their experiences and how they've engaged. But as shared earlier in the panel, we have a good number of students from all over the world, and we're very fortunate to have that. There's no difference when it comes to funding for our international students and our domestic students. The biggest difference, of course, is you can't apply for FAFSA or federal financial aid as an international student. But our scholarship, our merit-based scholarships and need-based scholarships, you still have access to those. And then a question came up about international medical graduates. So we have quite a number of students here who are physicians or doctors from all over the world, and they're joining us for either a public health degree or a social work degree. And if you're doing the public health program, it does require a GRE, but if you complete the USMLE, then that will suffice and take care of your standardized test requirement. And finally, the last one that we had ahead of time was, can you do a dual degree or a joint degree between social work and cognitive psychology? So you've seen the ones already in this presentation and online, but the answer to that is no. Our current ones that are set up for joint and dual degrees are the ones that we have published, and so we just want to make sure we refer to that. But we do have quite a few questions that we need to get taken care of in the next handful of minutes. All right. Scholarships and funding, I think we talked about that. Graduate assistantships, there are all kinds of graduate assistantships across campus. I know people working in like a Res Life or Campus Life, and so there's a lot of opportunities there. As far as the MSW Urban Design, that's a partnership with the the School of Art and Architecture, and I think for that person, if you could send us an email at Brown Admissions, and what we will want to do is we can send you a one-sheeter that gives you a curriculum breakdown, so that we can avoid going into too much depth on that for the time that we have left. All right, we have a little comment here. I've heard several MSW grad students talk about the stigma that comes along with the degree. Employers see social workers, students as having hard skills. Could you speak to some of the skills that you're developing to use and those you market for yourself to future employers? So this idea that like social workers only have hard skills, and what about those soft skills that we know are probably the most significant when it comes to promoting into move and advancing in your career? So I'd love to hear we have actually, fortunately, we have our social work folks around here who can talk about that.
Okay, so this is a very real fear, and it's very, very timely that this question is being asked. What we're seeing in the field now is a broader recognition of social work as a viable profession. Not because we can do things with people, but because we can do things with people and with hard skills. So I think if you're looking at asking the question, what skills do you gain coming from a social work program, I think here at the Brown School we focus very much on 3 things. 1 is service, 2 is evaluation of that service, and 3 is improvement of that service. And so you kind of get a three-prong approach to any hard skill, be it in clinical counseling or macro practice or anything in between, where you're delivering a service and assessing it quantitatively as well as quantitatively, and then directly involving yourself in improvement efforts. So if you're in an interview, career services will tell you interview along the STAR format. You're like, you have the answer. I was in this situation with this population. This was the problem. Here's how we met that problem, and then we performed an evaluation and improvement effort in that problem. And that's how we design our degree to set you up with. And then one other thing is, as a joint MBA degree student, one thing that I heard of in my MBA orientation just this past summer is the number one skill looked for from employers is communication and people skills. And if there's one thing that social workers have, it's communication and people skills. And so you will absolutely be able to learn and develop and use those skills when you're out in the job market. And that's what I have to offer.
Yeah, I would say going into the clinical mental health field, I've taken a lot of courses that have taught me maybe those hard skills. So I've taken a CBT class, an interpersonal therapy class, DBT. There's a wide variety of classes that you do learn those hard skills as well.
We also do have those skills labs that we talked about. And so those are really like grant writing, program management. Those are also like, and in program management, we're learning all kinds of like tools to run programs, which is something that social workers definitely do. And so those skills are really, I would consider those hard skills to be able to say, yeah, I've actually learned how to write grants. I've actually learned these skills for program management. I've actually learned budgeting. So those are things really optimal too.
That's great. So I'm noticing the theme here is that we do get quite a balance of both the hard and the soft skills, and I think that was kind of the bigger concern. And so it's great to hear that you all are at least kind of getting and feeling comfortable in that area. All right, so we had something that's a little more specific, and I just want to address it for sure. Just someone wants to go into the weeds here on personal statements, analytical essays, kind of like how did you decide what topic you did for each one, or especially your analytical essay. So what I would recommend is a couple of things. One is definitely take a look at some of our archive videos about applying. We definitely have some that are available. But our next session, or maybe a little later, I think maybe in October, we are actually, I guess that is our next session.
Yeah.
Excuse me. We're going to actually go into the weeds about how to submit your best application. We're super excited about that. So before we wrap up, I want to make sure I give our panelists, is there like one thing that you'd like to say before we kind of close ourselves out here?
One thing that I would say is a big difference that I think exists between the Brown School and maybe other schools is the community that's really here. One of my fellow students is now an alumni, likes to say we put the social back in social work, and I think that's really true. Like I feel super comfortable with everyone here, and it doesn't feel like a place I'm just going to take classes. It feels like a real community I have here, so I really appreciate that.
That's great. Yeah, thank you.
Yes, I found it that it's a home, and I was looking at different programs across the United States, including other top-ranked programs, and I feel here what I didn't feel there, and it is that social piece. But the one thing I want to say is whether or not you're considering and trying to apply early or just assessing where you're at in your professional career, the one thing that I've really found connection with here at the Brown School is understanding what my story was and what I think I can use that story to offer. And so if you're looking at applying early, definitely just think about what drives you, and I think you're going to find a connection with that here at the Brown School.
And I think if you're like nervous about applying or you don't know where to apply, definitely get into contact. People will talk to you here. That's something that I found was really different in my application process. Was I was applying to other schools, but they weren't trying to talk to me. They weren't trying to get to know me as a person. The people in this admissions office want to get to know you. They want to know your story. And so if you're nervous, I think you should just go for it and really explore your opportunities here.
That's great. So make sure you give us a call. I think there's a reason why we are the best social work program, and the reason why we're top 20, in fact, we're number 17 in public health, and I think it shows by the quality of students that we have, and I'm glad that you all feel the same way about us as faculty and administration. There are a few things that we want to really quickly wrap up with, so we'll change to the slides. Make sure you check out our virtual sessions. Come see us. There's a way you can visit us online, and that's up there. We can get you connected with current students and faculty. Just email us, and we'll get you as much information. We have our deadlines that are up there. You can find these online for our application. Our application should go live fairly soon here within the next week or so. And we also have a fall preview day that's coming up on the 27th. And then if our next info session is October 3rd. If you want to get a hold of me, my email address is up there. But just officially, I want to say thank you to our wonderful committee. And we look forward to hopefully seeing some of you here in a few weeks on campus. Otherwise, give us an email. And then our last thing is that there's a few of us who are going to be all on the road all over the country. And so, so just take a look at this list here. And if you think we're going to be in your city and you want to connect with us individually to have a one-on-one with an admissions and recruitment staff member, just email our main office and we'll get you connected. Or you can go online. We will show you who's going to be in what area and we can get connected. So we look forward to seeing you all. Have a good afternoon.